Hello. Let's see. I'm Randy Murphy at the Mobile County Health Department. I'm here to give you our Monday, March. Ooh, what is March? 29th. Oh my goodness. March 29th update on the impact of the COVID-19 pandemic and our vaccination efforts. So in Alabama, we're nearing 515,000 cases of COVID-19 and more than 10,500 deaths. For Mobile County residents today, we're reporting on 37,566 COVID-19 cases. 9 were reported to us yesterday. Listen to this. Yesterday, 9 were reported. On Saturday, 10 were reported. On Friday, 17 were reported. So luckily right now we're still, trending down and staying down. And I need to emphasize that in order to keep it that way, we need you to keep your vigilance. Please help us by, getting vaccinated and also by doing the things that you need to do to protect yourself, like wearing a mask when you go out, and, keeping separate from people who don't live with you, maintaining a 6-foot distance. We're hearing more and more about sporting events and festivals and gatherings that are starting to occur, and it seems that people maybe are thinking that, we're out of the woods with COVID-19, and that is not true. We are doing much better, and thank you for all your hard work in helping us get there. But with Easter and the holidays and some concerts starting back up, some sporting events starting back up, we really need you to respect that 6-foot physical distance and wear your mask when you are out and about, even if you've been vaccinated. So again, the number of cases very low. We didn't add any new deaths yesterday. The number of deaths with COVID-19 stand at 791. The cumulative number of patients hospitalized went up 1 yesterday to 4,811, and the number of people currently hospitalized with COVID-19 is in the teens. Just 17 yesterday. That was down 1 from the day before. So on Saturday, there were 18 people in the hospital with COVID-19. So that is very good news indeed to see those numbers continuing to stay low and again, moving in the right direction. So please be vigilant and help us keep it there. So we've also published our weekly expanded report, and again, showing the great downward trend in hospitalization and cases, hospitalizations, and deaths. One thing that I'm keeping a close eye on is our early indicator of COVID-like illness or influenza-like illness, and it has ticked up a bit. So again, this is the percent of people who go to the emergency department, the percent of those that are for COVID-like illness or influenza-like illness. So that is the earliest indicator that we have for COVID disease, and I'm a little concerned that went up a little bit in the last 2 weeks. The percent positive, so the number of COVID tests that are positive last week was down to 2%. So it wasn't 2%. The last time it was 2% was the week of March 15th. So as you know, we had very little testing going on in our first couple of cases. So we have hit a low with regard to the percent of positive tests. There are still lots of testing capacity out there. We need you to use testing as a prevention tool. So, before you travel or after you travel, if you're feeling sick, if you think you may have been exposed, please get a COVID test. It's very important that we continue to test a lot of people in our community, because that's how we can detect when things start to rise, is if we see an increase in the percent positive. And of course, we need you to get tested so that if you are positive, you can isolate at home or quarantine at home if you were exposed, in order to keep transmission down, to stop from spreading COVID-19 virus out and around. Okay, a little bit just to remind you, that we are at the cruise terminal today, so our staff are still there. There is no waiting, no line. They're giving Moderna vaccine today. Please, if you are listening to this broadcast and you have not been vaccinated and you meet the current eligibility requirements, please turn your TV off, get in your car, and go to the cruise terminal. It's really important. And again, it's phase 1A, 1B, and 1C. And then individuals who are 18 to 54 today, anyone with an underlying medical condition, basically. If you're an adult and you have an underlying medical condition, then you can get vaccinated today, no waiting, at the cruise terminal. And then anyone over the age of 55. And then all of those essential workers categories. So today we'll be there until at least 4 o'clock. Tomorrow we will be there at 8, from 8 to 4. On Wednesday, we will be there for 12 hours from 8 to 8 p.m. to allow anyone who has to work during the day and can't break free to come and get vaccinated. So Wednesday, 8 to 8. Then on Thursday, we'll be there noon to 8. And then Friday from 8 to 4. So the eligibility requirements, a screening tool, locations, directions is all on our website at mchdcares.com. So please go and get vaccinated today. And if you can't make it today, we should have plenty. We have plenty of vaccine available to give folks today. So please drop by and meet our friendly staff of public health professionals who can get you towards, protection that comes with vaccine. CDC released some information this morning regarding the effectiveness of the vaccine, sort of in a real world setting of the vaccine to prevent infections. When the vaccines were in clinical trial, the endpoint was, did the vaccines prevent disease? So symptoms of COVID and severe symptoms of COVID and hospitalizations and deaths. There was just, not enough information in the beginning, sort of in a practical, real, what they call real world experience to determine if vaccination could prevent you from getting infected, right? So that information has now been shared with the public. So working with, collecting data from the point of vaccination on, and healthcare workers who have the most opportunity for exposure to COVID through their jobs, people who are fully vaccinated, so within at least 14 days past their second dose, the fully vaccinated people, infection was prevented in 90% of the time. So a 90% effectiveness against infection, which is really amazing. And just with one shot, even with just one shot, people who are vaccinated with one and then 2 weeks later, they have 80% protection against infection. So this is really good news. And again, just more reason to please go and get vaccinated to protect yourself from infection. And, on the rare chance that you do get infected after you've been fully vaccinated, then prevent you from having severe complications, hospitalization, and death from catching COVID-19. All right, a couple of questions here. One is about the vaccine side effects. So I want to just address this. I brought it here someplace. I've got it marked. Thank you. I have it right here. Thank you. Address some early data on vaccine side effects. So, the clinical trials had, 20, 30, 40,000 people who were involved in clinical trials, but CDC published a report a couple of months ago now on the first month of COVID vaccine. This is with the messenger RNA vaccines, the Pfizer and the Moderna. I've not seen a similar report yet on the J&J vaccine. But basically, CDC evaluated the safety during the month from the middle of December to the middle of January. And during that time, 13,794 vaccine doses were administered. So nearly 14 million doses. And among these doses, There were serious and non-serious side effects, and let me just read a little bit about this. So this is for both vaccines. Injection at the pain site was reported in about 71%, fatigue in around 34%, headache 30%, myalgia 23%, chills 12%, fever 11%, injection site swelling 10%, joint pain 10%, nausea 9%. So again, lots of folks, nearly every large majority of folks reported things like injection site pain, fatigue, headache, myalgia. By far, the injection site pain, I think I know that mine hurt, but these are very minor side effects, and they generally resolve within 2 days. So what about severe adverse events? And the most notable one is anaphylaxis. So a severe adverse event associated with vaccine, and I want to make sure I get it in here right. Hold on a second. I might have to find it. So the big message is they are extremely rare. So the occurrence of anaphylaxis after receipt of COVID-19 vaccines during this period, there were 4.5 cases per million doses administered. So a very small number of people, just under 5 people for every million doses administered, had an anaphylaxis event after the vaccine. So again, a very safe and effective vaccine. So please get it and help us protect yourself, your family, and your community. All right, let's see. Someone asking about, we're starting to get lots of questions about, hey, the baseball park didn't appear to be implemented, to ensuring social distancing. Hey, our church wants us to come sing with them for the Easter cantata. We're starting to hear lots of questions about this. And again, anything that you do outside of your household increases your risk of COVID transmission. The way you decrease that risk is by wearing your mask, physical distancing, keeping that 6 feet apart, limiting, gatherings to small outdoor gatherings with just your, maybe people who have been vaccinated. Anything you do for medium and large size gatherings or indoor gatherings or even outdoor gatherings where households are mixing, right, where you're not able to keep that 6 foot of distance between your households, all of these things increase the risk of COVID transmission. So let's see. I think for a fully vaccinated person, if you are in a indoor space at a choir practice and everyone else is fully vaccinated and they have been fully vaccinated for at least 2 weeks, then you have a lower risk of infection. But if you cannot verify that they're vaccinated, then these indoor events increase your risk of COVID transmission, particularly when you maybe you're mixing people from the Mobile area with people from other geographic areas when you don't know what the risk, their community transmission looks like in other counties or other states or other parts of the world. So be careful. If you've been fully vaccinated, great, congratulations, thank you. But still use a healthy dose of caution when you are interacting with people outside of your household. And this includes religious ceremonies and choir practices and that sort of thing. All right. Let's see. I think that covers it. All right. We are still available, the health department is still available to consult with agencies, businesses, event planners. We're still available and ready and willing to consult with you. If you are planning an event, we would very much like to hear from you so that we can make sure you're receiving and following the most recent guidance and offering, some assistance in reviewing your protocols. We are doing everything we can do to try to prevent a big super spreader event that often can come with things like crowded beaches or crowded venues or, in-person inside gatherings, that nature. So we really want to applaud everyone who's continuing to wear your mask and social distance and get vaccinated. And we need everyone's help in doing that. So I think I'll stop here for today. Remember, go to the cruise terminal, get vaccinated this week. We got plenty of vaccines. So please, please, please make a plan to go to the cruise terminal during the day. If you can't make it during the day, Wednesday and Thursday, we will be there until 8 p.m. All right, I'll stop there for now, and we'll check in with you again on Friday.